Today, we're getting to know certified family nurse practitioner Kafila Jaipuri, who sees patients for comprehensive primary care at the Kirby Primary Care Practice in East Memphis. This is One-on-One with Regional One Health, your inside look at how we're building healthier tomorrows for our patients and our community. Join us as we get to know some of the individuals who help provide life-saving, life-changing care for our community. Thanks for listening. I'm Joey Waller. Hi, Kafila. Thanks for joining us.
Thank you for having me today.
Great to have you. So first, where are you from originally, and what would you say most inspired you to go into the medical field in the first place?
So I'm basically from India, and I always wanted to be a part of healthcare industry. I wanted to be in medical field since I was a teenager. And that's how I started my career, to start with as a foods and nutrition specialist. Specifically, I was a dietitian, but after getting married and coming to USA, I was exploring my options in my field here in USA. And that's when I came across the healthcare profession. Later, I got my degrees from India, credentialed here, and was able to pursue an accelerated 1-year BSN program. When I started working my first job in a primary care setting as a nurse, I saw how the patients develop a relationship with their doctors here over time. And they start considering them their protectors, their whole and soul caretakers, their answers to any and every healthcare needs, and how that bond helps the doctor themselves to take care of the patients. So that relationship and the bonding that I saw is what inspired me to become a primary care doctor and take care of the individuals holistically and channel them to the right direction as needed. And that's where I've further enhanced my career into becoming a family nurse practitioner.
Great. And I'm going to ask you about that background that you mentioned in diet and nutrition again in a moment. But first, let me pick up on what you just mentioned about that relationship, that bond between patient and medical professional. Why is that so important to both parties, do you think?
The thing is, it's the primary care doctor basically has to develop that bond and that relationship with their patients for a healthy relationship, and the communication and the conflict resolution skills. These are very important for the betterment of their health overall. Developing that strong bond with the patient also helps the doctors, the NPs, the PAs develop better understanding and awareness of the healthcare needs of the individual. And it's not only, the patient's primary care provider who can help. It's basically them who can help them provide and understand how to navigate the complex healthcare system, understanding their insurances, their referral processes, and all of those stuff.
Great point. There's a lot of other things connected to the actual visit to the office, of course, that go along with the experience for both doctor and patient. For instance, what services overall would you say you provide doing primary care? Because obviously it's kind of a mixed bag of a little bit of everything, right?
Right. It's a multiple things that we take care of. Being a primary care doctor, as the name itself says, primary care provider, we establish care and provide the primary care to the males and females of every age of life. We provide them with the tips of maintaining the overall healthy lifestyle to prevent the illnesses. We counsel them about the importance of the preventive care for an optimal health. If we see, from the beginning of the childhood, we provide preventive care to the pediatric population, making the parents aware of the recommended childhood immunizations and the common childhood illnesses, educating these parents, about the developmental changes and the challenges to expect as they grow into an adolescent, understanding and addressing their mental health conditions, their substance abuse concerns, and all those things. We provide insight into men's and women's health to make them aware of the routine screening tests, the preventive care recommended for their age, like the regular pap smears, breast exams, mammograms, prostate checks, colon cancer screenings, and many other screening tests. It is through these primary care screening tests that we conduct at a primary care level as a PCP that we can catch any cancers or any chronic diseases in an early stage and refer them to the appropriate team and get them started on the treatment in a timely manner. We kind of provide them all kind of immunizations that are recommended for their age to prevent and to manage infectious diseases like flu, pneumonia, shingles, tetanus, hepatitis, and many more other infectious diseases. An important aspect of this age group is also to create awareness of the importance of sexual health and the safety to avoid the sexually transmitted diseases. Moving forward, I would say we help the geriatric patients to age gracefully, preventing and managing the age related health issues so that we can minimize their hospitalizations. We also provide them comprehensive Medicare wellness physicals, which are required by the insurances. We help them set up with the home health and the other required facilities so that we will be able to help them to get their regular healthcare needs as they are aging. We manage chronic conditions with medications, with lifestyle changes. We try to do timely lab work, diagnostics, make sure the patients are getting their refills on their medications, they are being compliant with their medicines, making sure that they are referred to the specialist when needed and they're following with them. Going forward, we talk to the patients regarding this. This is one of the very important aspects that I would talk about is their mental health and wellness, understanding and managing stress, anxiety, depression, abuse, mood disorders, sleep disorders, and many other mental health issues, providing them the different treatment modalities, medications, therapy, counseling, and then trying to refer them to the psychiatrist in a timely manner to prevent suicides, which we know is a very highly prevalent in our society due to lack of the mental health care on time.
So you're really covering just about every base there is there. Would
Uh-huh.
probably have been easier for you to list what you're not responsible for as opposed to what you are on a daily basis, right?
Mhm.
Let me ask you this. So when patients come to you, as you just touched on a moment ago,
Mhm.
you and those you work with not only provide your own care, but you mentioned you do referrals. How important is it that if you're going to a primary care physician over a period of time and there is that relationship that you've discussed, you then can provide references so that if they need specialists, they know they can trust you
Mhm.
to make those recommendations?
Yes. So, regarding the referrals, it's a very important part of the primary care because the primary care initiates the care, initiates something, and when we make a diagnosis, we start them on the treatment, but then we want to make sure that there are no complications going on along with those chronic diseases. Say, if they have diabetes, we can start them initially on the treatment, but then we want to make them sure that, they follow with the endocrinologist so that if their diabetes get out of control or the diabetes is affecting their heart or they're affecting their kidneys and all those things, then they need the appointment with the referral to those specialists so that they can be taken care of from the holistic point of view and not just from a single point of view of a primary care doctor, but then the patient starts seeing a different specialist so that every aspect of healthcare is taken care of.
Gotcha. Let me switch gears for a moment. You mentioned you're from India originally. I know you have a family. Can you tell us a little bit about your family and your life outside of work? What do you and your family like to do so you can unwind when you're away from work?
So I'm a very social person and I'm always busy with lots of family and friends gathering over the weekends. I like running and I involve myself in various half marathons, 10K races throughout the year. I like doing interior designing for my house. So I have a project in my mind that I'm working on. And I also am very busy with my 11-year-old daughter's like various activities that she engages herself in, mainly her like volleyball tournaments, classical dances, and the Bollywood dances.
So, you mentioned earlier as well that you've got this background in diet and nutrition. How beneficial is that since, as we all know, so many health problems are in fact caused by people not eating right and not getting the right amount of nutrients, right?
So that is one of my major, I would say, counseling that I provide to all my patients. So when I see my patients, all my chronic patients, especially like diabetes, high blood pressure, high cholesterol, all those patients, if you provide insight into the nutrition, the healthy diet, and create awareness of how the diet can be a key factor in managing the chronic conditions, I have surprisingly noticed that when patients are educated regarding those healthy eating habits, and they really understand the health from the diet point of view, the patients have started seeing that how they can better manage their chronic conditions. And they really appreciate me counseling them regarding their diet, which I'm not sure which all the providers can do it to that extent than what I can because of my background being a dietitian. And definitely I have seen my patients love to follow my guidelines, and that has helped them in taking care of their chronic illnesses in a better way, along with the medications, the treatments they're already taking.
Yeah, that sounds great. Let me ask you finally, in summary here, what would you say is the most rewarding thing about the work that you do? What are you most proud of on a daily basis?
The most rewarding about any PCP would be the satisfaction that you would get from your patients when they have achieved a desired goal. Say, whether it is in achieving a hemoglobin A1C of less than 7, whether it's a blood pressure management and achieving the goal of less than 130/80, making them understand the importance of treatment, making them compliant with the treatment, making them help them, lose weight with diet, lifestyle changes, exercise, whatever it takes to help them lose weight, able to provide them regular screening tests, able to channel them to the right direction, keeping them out of the ER, keeping them out of the hospitals. When you see that patient have achieved those goals, that are most rewarding and reassuring to ourselves as a provider when the patient comes and appreciates us and thanks us for the care we provide.
And you can even mix in a little advice every now and then on running and interior design as well, right?
Yeah, that's true. Yes, you can add that too.
Jack of all trades, as we mentioned earlier in our chat. Well, folks, you've now gotten to know family nurse practitioner Kafila Jaipuri. Kafila, thanks so much again.
Thank you for having me today.
Great to have you. Great to meet you. And again, Kafila sees patients for annual exams, treatment of illness and chronic conditions, and other needs, as she mentioned, at Kirby Primary Care in East Memphis. For an appointment, please call 901-515-5350. Again, 901-515-5350. Now, if you found this podcast helpful, please do share it on your social media. And thanks for making One-on-One with Regional One Health part of your journey to better health. Join us next time as we introduce you to another member of the Regional One Health family. Hoping your health is good health. I'm Joey Waller.